yields back. Next, I'll recognize Congresswoman Lesko for her 5 minutes.
Thank you, Mr. Chair, and thank you to the people testifying today. I'm from the great state of Arizona. Dr. Mallow, in your testimony, you spoke about the health benefits of permanent standard time. Arizona has observed permanent standard time for 40 years now. Has there been any medical studies done or medical data to demonstrate that Arizonans are less likely to experience the negative health outcomes you described if we went to permanent daylight time?
That's a great question, and I have not been able to find that. I think most of the work has been done more on these edge effects and all, and trying to look at health issues. So no, I'm going to continue to look for that, and if I find anything, I'll let you know.
Thank you. And I said the same thing to the chairwoman is please don't mess with Arizona. We've been doing this for 40 years. There's differences in the states. In Arizona, it's very hot in the summer. In fact, a lot of our workers that work on rooftops doing new roofs or on the highways, they actually work in the middle of the night because it's just too hot. And so anytime you change anything to Arizona, Arizonans are going to be upset, and it will have consequences that people from the East Coast may not think about. And with that, I yield back.
The gentlewoman yields back the balance of her time. I'll recognize myself for 5 minutes. I'd like to thank the witnesses for coming today and for your testimony and your opinions and conveying your research to us as well. Also to the chairwoman, thank you so much for having this important issue discussed before the people of our country. And also Ranking Member Bilirakis, thank you so much as well. As was mentioned earlier, there are many, many issues that we could be discussing in this committee. And believe it or not, this committee is a very prolific committee covering probably more issues than any other policy committee in the House or the United States Senate. So with that, I'd like to once again thank all the chairs and ranking members of all the committees for all the important issues that we cover. And we can walk and chew gum at the same time in the United States Congress. And we can talk about time zones and what it does to people, especially our children. So with that, Dr. Mallow, in your testimony, you touch on the effects on transitioning from standard time to daylight savings time every year in March, and the negative effects that are associated with sleep loss has on adolescent attention span and mental health. You mentioned depression specifically. Can you expand on how losing even as little as 30 minutes of sleep can affect adolescent mental health?
Yes, thank you so much for that question. I have been impressed in the work I did with the consensus panel of the American Academy of Sleep Medicine. We reviewed many, many studies, and even a small amount of sleep loss can make a huge difference in how our adolescents feel and how alert they are in school, their mental health. You know, I know things have been said about the screen time in the afternoons, and I certainly see that it's a complex picture. It's a lot of different things. But I, as a sleep specialist, feel like the root cause of so much of what's happening with our adolescents is the poor sleep and the fact that they're just really sleep deprived. A lot of them aren't even getting 6 hours of sleep a night. And light in the morning would help tremendously, along with, as was mentioned, making school start times later, which would help promote sleep.
I'd like to ask you a question, Dr. Mallow, in your expert opinion. Let's just say a child is playing video games for 4, 5, and 6, and 8 hours a day. And what kind of effect could that have on a child's sleep pattern if they're doing something like that in a chronic way, where they're actually doing it daily, they're doing it very consistently, and something that perhaps is a question mark for me is, could that have an effect on a child's sleep?
Yes, for sure. When kids are on their phones, it can affect their sleep patterns. The way I look at it is there's blue light from our phones. You probably have heard about that. Well, sunlight is the most potent source of blue light. So getting those phones out of the bedroom and being turned off at night, and also trying to get rid of some of that excessive light. Again, we're not talking about light at 5 or 6 o'clock. We're talking about light at 9 o'clock, 10 o'clock that really interferes with sleep. And sunlight is one of the most potent sources of blue light there is. So it's the key source. So I think we need to do both. We can't say it's just the times. I think we have to look comprehensively at what's going on with our kids.
Well, Doctor, speaking of comprehensively, it just occurred to me that perhaps at least twice a year, maybe we, whether it's state governments, local governments, and federal governments, when people are finally thinking about daylight or darkness and having to change their clocks, maybe that's a great opportunity to remind the American people about maybe some better practices, like how to help people to ask their kids or get their kids to get outside and get some of that sunlight. Do you think it'd be a good practice for us to try to do something like that?
I do. I mean, I take advantage of what I call and my colleagues call the twice yearly media blitz related to daylight saving time, going back and forth to really educate the American public on sleep and its importance, and getting off your phones, getting more exercise, getting more morning light. All of that is super important. I think that's a great point you made.
Okay. Well, thank you. I know that some of the testimony has to do with economy and things of that nature, but I think well-educated school kids, if we focus on them, that will definitely contribute to a stronger economy when they are actually better educated and better prepared to enter into the workforce. So whether it's daylight savings time or anything like that, I think it's important for us to recognize that we have opportunities to go ahead and enlist other policies and other activities when people are paying attention to these kinds of things. Next, my